And joining us now here on the Granite City School District Alumni Spotlight, joining us all the way from Washington is Dr. Cory Simpson. Dr. Simpson, thank you for joining us.
It's my pleasure. Thanks for inviting me.
My name is Chris Mitchell. I'm the manager of district communications, and this is a monthly alumni feature that we are doing with the Granite City High School alums. Well, Dr. Simpson, my first question is, I want to talk a little bit about growing up in Granite City. I know you're a 1999 graduate of the high school. What were some of your interests growing up in Granite City?
Gosh, I had a great childhood in Granite City. I went to Frohart Elementary and, stayed in the Granite City School District all the way through to high school. Had a great experience and just a fantastic group of friends that I still keep in touch with today when I'm back in town. We've been Zooming the past couple of years during the pandemic, but still keep in touch with them. So I had a great experience growing up in Granite City. And, I got interested in math and science pretty early on in school. I sort of naturally gravitated toward those subjects. And as I went along in high school, had some really fantastic teachers teaching me chemistry, physics, biology, and just really got me excited about the natural sciences, but then also how they could be applied to humans in the form of medicine. So that's kind of where I first got my interest in medicine, was really in high school, as I was learning about, chemical molecules and reactions and different species, and how that can apply to our knowledge of medicine.
So, Dr. Simpson, you went on to study at WashU, a place that I spent 20 years of my professional career, so I have much respect for WashU. And I know you also studied at Northwestern. Talk to me about, when did you know that you had a passion for medicine and giving back?
Well, yeah. So when I got to WashU, I was originally a chemistry major because I really loved chemistry. I remember learning from Mrs. Heath in high school and Mr. McLean. Doing all this chemistry stuff was so interesting to me. The way it worked just sort of clicked with my mind. So I knew I wanted to be a science major. I started out in chemistry and then got to some really hard stuff in chemistry, theoretical stuff, quantum physics, and decided hey, this is a little bit too obscure for me. And I realized what I liked about chemistry was how you could apply it to biology. So biochemistry, and how you can apply chemistry to making new medicines and how that can actually improve people's lives and treat disease. So that's what really got me into thinking about medicine. Really, my kind of outside interest in sort of doing more community service type work and increasing access to medical care through volunteerism really came out of my experience in college. When I was at WashU, I minored in Spanish and took a course in medical Spanish to learn how to communicate with patients in Spanish, which is totally different than learning to talk about your favorite color of food, right? So you have to learn about all the body parts and symptoms and things in Spanish if you're going to be a communicator in a different language in a patient care setting. So I had the chance through that medical Spanish class to actually, it was a required component to spend some time at a free clinic. And that's where I really got an experience to understand that there's this whole other side of society that, I lived a very privileged life and had great parents and, had a really nice upbringing. And there's a lot of people that haven't had that experience in our country. And to be able to see that firsthand and to volunteer there and be able to spend time was what kind of set me off on a trajectory of really making sure that all the way through my training, I made sure that giving back was part of what I did. So that really carried through to medical school, where I volunteered at a clinic all through medical school that primarily cared for immigrant patients. So mostly those of Latino origin or Polish patients who didn't speak English necessarily. So we had a clinic that met them where they were and sort of provided primary care to them. And then I continued that even in my later medical training when I moved to Philadelphia and started doing clinical volunteering at a dermatology clinic. If you think it's hard to get in to see a primary care doctor, it's even harder to get in to see a specialist like a dermatologist. So we started a volunteer clinic there where we reached out both in person, but then also used technology, so smartphones, to basically connect those patients who otherwise would never be able to see a specialist, to use a smartphone to send pictures back and forth to a specialist to provide input on, what their rash was or what that spot is and whether it might be something cancerous, for example. So it was something that I thought was important to prioritize kind of all the way through my training, and still am working to do that type of stuff now, just to give back to the community I live in and sort of recognize that when you've been given a lot is expected of you to sort of give back to your community.
So, Dr. Simpson, you have spent some time in St. Louis. You've been in Chicago. You've spent time in Philly, like talked about. Now you're in Seattle at the University of Washington. Talk to our viewers today. What's Dr. Simpson doing at the University of Washington?
So yeah, I've had the chance to be in a lot of different cities, and one thing I wanted to mention before I get to that was, having had the chance to travel was a huge thing for me, and that actually goes back to my Granite City roots. So there was a wonderful man who was a teacher in Granite named Alan Kreider, and Alan was crazy enough to take a group of 50 junior high students, or at least 50 of us, to London, and that was the first time I ever had the chance to leave the country. And that was an awesome experience to me to sort of see the world that's out there. And so we had a huge group from Granite City that actually went to London and did all the sites and saw everything that there was there to offer. It was really awesome. And that was something we did, sort of after school programs, selling pizzas, candy bars, that kind of stuff, having a rummage sale to raise money. And that was an awesome experience. So that was what really got me sort of the courage to leave home. And so that's put me in a lot of different cities. I was in Chicago for about 10 years and then moved to Philadelphia for training, was there about 8 years, and then now I'm in Seattle. So here, it's really been an awesome experience. It's a totally different culture and climate, but I'm really excited to be here. I've been here just a few months, kind of moved here when the weather was turning south for the winter months here. It's not cold, but it rains a lot, and it's pretty grim and dim. But anyway, I love it here. What I'm doing now is really what I've been setting out to do for a long time. You and I mentioned that the wall of diplomas behind me, and that's what happens when you're a student till basically you're 40 years old and finally get your first job because you've done nothing but learn your whole life. And so now I'm finally in a position where I'm basically an independent professor. So I now have a position at the university where my job is kind of threefold: to do mostly research, so biomedical research, trying to figure out disease stuff in the lab about skin disease, rare diseases that I study. We can talk a little more about. The other part of it is education. So I get to teach medical students and people who are specializing in training in dermatology and help to teach them about certain disease states. And then also, patient care. So I see patients 1 day a week. I run a specialty clinic that's really for rare skin disorders. So I remember actually one of my friend's parents, when I was matching into residency, which is what decides what specialty you're going to train in. I remember one of my friend's dads was like, dermatology, why would you waste your time doing that? You want to pop pimples for the rest of your life? And the thing is, the research that I had done was on some rare disorders. So people get these rare diseases where their skin basically blisters and falls off. And it's like being burned over your whole body. And it's extremely, risky for these patients. They can die from it. So there are these really rare disorders. And that's something that I felt really compelled to study, was these rare disorders that, drug companies aren't going to develop a drug for something that affects 1 in a million people. So for those who are suffering from rare disorders, I happen to study autoimmune disorders and genetic disorders, people that were born with a genetic problem that leads their skin to be sort of fragile and blister off. And there's really no treatments for those folks because there's not much of a market for it. So it's hard to leave it to the private industry. And so that's where the federal government, which invests in the National Institutes of Health, really gives out grants to help people to understand these rare diseases that otherwise there's not going to be a marketable sort of research line of funding for that type of disease. And so that's what I study in my lab, is trying to figure out, can we model these diseases in the lab? Can we figure out what's going on in the skin? And can we think about new ways to treat these things so that patients who have these rare disorders can have better access to therapies? So it's really exciting to be able to combine, teaching, medical care, and research together. And that's the variety of what I do. Every day it's a little bit different. And I really love it. It's a chance to use the sort of science skills that I first accumulated in high school and apply those to the lab experiments that I'm doing. I've got Bunsen burners sitting outside this office, just like the stuff that kids are using in chemistry lab at the high school. So it's very much something that I learned early on in my education in the public school system that still feeds my career today. So it's really a privilege to be where I am. And I'm excited to be here after all the training I've been through to finally kind of launch out on my own and try to build a research program here to better understand those rare skin diseases.
I appreciate you sharing that story with us, and I can tell that you have a real passion for what you do, and that's exactly what we want our young students at the high school and in the school district to see, that to find that job that you really have a passion about. Now we're talking a little bit about labs. I want to ask you, when I did some research on you, Doctor, I found that your first job in a research lab, you made food for fruit flies.
That's right.
Talk to me briefly about that and how that kind of impacted maybe what you're doing today.
Yeah, so when I was an undergraduate at WashU, when I switched from chemistry over to biology, I decided I wanted to get some research experience because that's good if you want to go to medical school. It's good to get some lab experience and do some research. And so you kind of have to start with the entry-level position. So I joined a genetics lab, was a fantastic professor named Sally Elgin, who's really a dedicated educator. And she took me on as someone who had no lab experience before, like in a research setting, and kind of started me at the bottom and said, here's the first job I have everybody do. And you're basically making food for fruit flies. And so, most people swat at fruit flies and kill them, but this lab used fruit flies as a model system. And so, sometimes, I don't want to get too political, but sometimes politicians get to talking about, well, why in the world are we studying these weirdo things and these scientists are wasting tax dollars? But, fruit flies are actually one of the most genetically manipulable type of model systems. And it's incredible that fruit flies actually have a lot of the same genes that humans do. And you can experiment on them. You can grow, thousands and millions of fruit flies basically and study their DNA and try to understand, well, how does this gene in a fruit fly, how does their DNA relate to a disease that humans might have? So sometimes it's really important to use a really simple model system that you can really design a clear-cut experiment. And you have the ability, the powerful ability to just make tons of these fruit flies and to find out something really cool about biology, and then take that idea and kind of expand it over to human biology and say, well, does this apply? Can we take what we learned in fruit flies and understand human biology? And so that's where what we call basic science or fundamental science, which is like really drilling down to the hardcore basic science principles, and then trying to take those and understand how can they be applied to human biology, and can we get something that's useful to humans out of them, like a new drug treatment or a new understanding of biology or development.
Wow. Thank you. Thank you for sharing that story. As prepping for this interview, I was really interested to hear a little bit more about that. Let's talk about this independent wet lab at the University of Washington, the Simpson Lab. Tell us a little about that, Doctor.
Yeah. So a wet lab means you basically are doing, experiments that involve, getting your hands dirty. So working with cell cultures. So, if you learn about the basic cell in biology in high school, that every tissue in your body is made up of tons of cells. And so they all kind of form together to form tissues like skin. And that's what we study in the lab, is basically looking at cells and trying to understand how do all of these, billions of little cells work together to form a tissue like the skin. And so can we understand how they do that in a very basic way in the lab by doing experiments on their DNA, by putting them in a petri dish that basically allows us to grow like a skin graft in the lab. You can basically grow a piece of human skin that comes from donor patients who've donated cells to our lab. We can grow them in the lab and actually make little pieces of skin. And that makes it a lot easier to do experiments on, rather than trying to work with a patient. You don't want to hurt patients until you understand, you don't want to hurt them at all. And if you're going to do a clinical trial, like trying out a new medicine, you want to understand how does that drug work in a very basic lab environment before you take that treatment and take it to a patient. Because again, the first principle of medicine is do no harm. So you want to make sure that something's safe and effective before you march it into the clinic and try it out on a patient. So that's what we do in the lab, is really try to understand the basic biology of how do cells form together to make a tissue like the skin that protects our body, that gets burned in the sunlight, that can be subjected to chronic wounds, and that gets mutated in certain diseases where patient's skin becomes defective and it falls off and forms sort of blisters and chronic wounds that can be really devastating to patients. So that's what we do in the wet lab. We pipette things using things to move chemicals around and making up solutions and pH meters and all kinds of stuff to actually get your hands dirty. And it's actually very fun to do that. And what I'm excited about having my own lab now, where I'm kind of at the head of it, is to be able to hire people to work for me to help me accomplish our mission. And that involves teaching people and training them to work in the lab and showing them kind of my excitement about science and trying to pass that on to them. One thing I wanted to go back to is about, you had asked about how I kind of got into medicine, and something I wanted to mention and sort of give a shout out to is Granite City High School has had a job shadowing program for a long time. When I was in high school, Cindy Gagich, I think, had sort of originated that program. And it was a fantastic experience for me and many other students because you were able to identify a career path that you thought you might be interested in. And most high schoolers haven't, had a chance to really explore a bunch of different jobs. Maybe some have had kind of an intro level job working in retail or at their parents' business or something like that, or cutting grass. And, that's all I had done up to then. But then I had the opportunity to say, I think I'd like to be a doctor. I want to see what it's like. And so they paired me with a physician who was over at WashU's medical campus at Barnes Hospital. I still, I follow that person. Her name's Dr. Ashley Hill. She was the daughter of a PE teacher, Mrs. Hill at the high school. And so she volunteered to take some, immature, crazy high schooler under her wing for the day. I got there, I think, at 7 a.m. She said at 4 o'clock, like, hey, the day's over for you if you want to leave. And I said, well, is there more to see? I stayed behind and was there until like 7 o'clock at night. I watched an autopsy. We looked at biopsy specimens. She was a pathologist and really kind of introduced me to the idea that you can use science and microscopes to better understand diseases like cancer and things. And so it was a fantastic experience. And if Granite City hadn't provided me that opportunity to shadow that doctor, I might not have ever gotten onto this career path. But, that's what I'm trying to do now, is really kind of inspire the next generation by having people come and visit my lab. I've got a student joining me this summer to come and learn about biology and how it applies to, a human skin. And so that's something that I think really started at an early stage at the high school, was getting exposure to different career paths is really important for, teenagers and high schoolers to do, so that they can know what they want to explore once they get into college. I think it's really important to have a good idea what you want to do, whether you go to, a trade school and learn a trade, or whether you go to a four-year university, or whether you work straight out of high school. It's really important to have some exposure to, like, what excites you, what are you passionate about, what do you want to do for the rest of your life? And not that you can't change later on, but having the ability to explore those jobs through a job shadowing program was just really, really insightful and helpful to me.
So last question I have for you, Dr. Simpson, is what advice would you give maybe a Granite City High School student who thinks they want to go into medicine, or just advice in general? Obviously, you've been out of school now for a while from high school. What advice would you have for a 16, 17, 18-year-old student at our high school?
Yeah, I think the shadowing is a big thing. So if you have a field that you think you're interested in, don't be embarrassed or, feel like you're a pain to somebody if you reach out and say, hey, I'm really interested in engineering. I'm really interested in teaching. I'm really interested in medicine. I'm really interested in accounting. And shadow somebody. Find somebody who does what you think you want to do and reach out to them. Most people, if they like their job, are going to be actually kind of, enthusiastic and sort of like honored that somebody said, I'd like to come and see what you do. And I think that's really cool. And so don't be afraid to talk to the guidance counselors at high school, or other sort of career advisors, or other adults that you know, about making a connection for you and giving you the opportunity to go look at what somebody does for a living. Because what you see on TV isn't always exactly the nuts and bolts of the jobs. It's important to see it in real life. The other thing I think is try to travel. I think, I love my hometown. I am really proud to have grown up in Granite City and to have attended public high school. But I learned a lot by getting outside of my hometown and going to see the rest of the world and learning about people who look and think and act a lot differently than I do. And I think that diversity of perspective really helped me to be who I am, so that as a physician, when I meet somebody who comes from a different background, grew up in a totally different country, doesn't speak my language, I can try to relate to that person based on just understanding that people come from very different walks of life. And it's important to have that breadth of perspective. And I think you get that by going and seeing what's out there in the world and being excited about people who aren't necessarily the same as you, who grew up in a different type of town. And I think that's really cool. The last thing I'll say is, I think it's really important to work hard, but I think something that I've learned along the way is that you want to zoom in and really focus in on things that you need to do. That math test that you got to pass, that science course that you got to get past, that ACT or SAT or whatever it is you have to get over the hump to get into college. Focus on that, but also take some time to zoom out and think about the broader world around you, because that's sort of where we draw a lot of our inspiration and satisfaction from, is learning about things that are outside of a book, real life experiences, and the friendships that you develop in high school, the family members who've invested in your career, the teachers that you've had there and sort of being grateful for what you have and the opportunities that you've been given. And so I think it's really important to zoom out and think that there's a much larger world around you, to be appreciative of the opportunities that you have, because not everybody's been given even as much as you have if you think about the larger world. So it's really important to sort of zoom out once in a while and think about beyond the stress of the everyday and that test that you got coming up. Think about the big picture and think about, what makes you happy in life. Think about giving back to your community. Think about giving back to your hometown and being an inspiration to other people, being a volunteer to give back to people who have less, who are less fortunate than you are. And I think that brings a level of reward and satisfaction in life that just doesn't come from being buried in books all the time or, sort of being self-centered. I think it's really important to zoom out outside your own little world and think about the broader community, your hometown, but also the world around you and the issues that are facing it.
I appreciate you sharing that with our students, Dr. Simpson. Now, I have one bonus question for you. Now, all the things you've accomplished in your career, graduated from WashU, graduated from Northwestern, you've opened your own lab, you have your first adult job, as you would say. Was being named Class Einstein in 1999 the top moment of your career so far?
I would say, that's somewhere on my resume, I'm pretty sure. Yeah, definitely, obviously, you take on a persona in high school. I was much of a bookworm in high school. You and I were talking earlier about, athletic abilities, and my brother basically inherited all of the athletic genes in our family. I barely made the golf team. But yeah, no, I really enjoy studying. I really like reading. I like writing. And it's just been an awesome privilege to me to sort of take on that bookworm attitude and use it to my benefit. I mean, I love what I do, and I'm excited to be where I am. And being a professor is basically being a professional student for the rest of my life. So I think that that sort of notoriety from my classmates who voted on that, I think I'm very fitting, and I'm proud to carry that moniker as a bookworm.
I love your passion, Dr. Simpson. We do have one special guest, though. Today, I came into the office and I was sharing with some people in the board office that we were having a guest today on our alumni spotlight. And Miss Carrie Wallace in our office mentioned that one of your relatives was working in our office today. So we do have someone that would like to say hi, who is currently working in our office today. Your mother, Vicki Simpson.
What are the chances?
What are the chances? Exactly what he said.
So
yeah. Well, hi, Mom.
Hi.
I'm like a full-grown adult now, and I still have my mom coming in on interviews. This is funny.
Well, Dr. Simpson, I wanted to thank you very much for sharing your story, sharing your passion, hopefully talking to some of our students, and hopefully they can take something from this discussion that we had, and hopefully encourage them to go out and either make a difference in their community, or, like you said, to meet someone that might do something in their life that they might want to, follow in their footsteps.
Yeah, I think the last thing I'll say is that if you have an experience with a teacher in high school that's really rewarding and really inspiring, and you learn something later on, and it's really important to circle back to them and let them know that. Let them know that they made an impact on your life. I've met up with some teachers since I graduated, and I think it's important to them to let them know that they had an impact on you in high school all these years later, and I still make a point of doing that. I had some amazing teachers there who really invested in me, and I'm really grateful to those folks.
Well, Dr. Simpson, thank you very much for coming on here as our alumni spotlight, and we wish you the best moving forward.
My privilege. And if there's anything I can ever do to support GCHS, please let me know.